Hello everyone, it's Dr. Dave. Hopefully you're all doing well. You had a wonderful weekend. You're looking forward to a good week ahead of you. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update to start the week. It's Monday, May the 10th, 2021. Going to look at 6 areas of health and wellness somewhere around this video. You can, as always, read through all 6 of those areas. If you'd like a copy, DM us on social, send us an email, give us a call at the clinic. We'll be sure to get that to you. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, by staying in the loop, by staying active with your own health and wellness choices and decisions and actions throughout the day, you'll be supporting some improvement if it's needed and or sustaining some wellness if you're already doing pretty darn good, which is great if you are. Let's make sure we keep it that way, and we can help those around us along the way as well. So diving into some information, never a bad idea. Sleep Medicine Reviews, March 2021, talked about sleep apnea, when people stop breathing for certain periods of time throughout the night. And it affects what's called the autonomic nervous system, the nervous system that controls your organs, glands, and blood vessels. So they looked at data from 71 studies, and it suggests that obstructive sleep apnea can affect the autonomic nervous system and how it functions related to relaxation, digestion, stress response, and heart rate. Now, why that's important is they speculate that that's the mechanism by which people with sleep apnea are at increased risk for cardiovascular disease. However, if we look at the ability to relax, digest, and have a healthy stress response, as well as our heart rate variability, this can be a contributing factor to many different health problems. So if you or someone you know has sleep apnea, stops breathing as they're resting through the night, good to get that treated appropriately, and it'll have a benefit on overall health and wellness. Nutrients, of course, nutrition, what we put into our bodies, good for overall health and wellness as well. And the journal Nutrients, or the report Nutrients, March 2021, looked at poor diet being bad for the brains and the gums. So new research suggests that consuming a pro-inflammatory diet, that's a pattern characterized by high intake of red and processed meat, high-fat dairy products, and refined grains, is associated with an elevated risk for both periodontitis, gum disease, and cognitive dysfunction. Can affect our noggin, our brain a little bit. Inflammation, not good. So good to clean that up and to focus on getting an anti-inflammatory style diet, or just an overall good healthy diet, one of which we recommend, of course, is the Mediterranean diet. So if you're looking for a guideline, you can Google that one, and it's good to follow as closely as you can. Although we want a good sleep, we also don't want to be too sedentary. The Scandinavian Journal of Medicine and Science and Sports, April 2021, looked at avoiding uninterrupted sedentary time. Past research has shown that prolonged periods of sedentary behavior can lead to the accumulation of biomarkers in the blood that are associated with an elevated risk for cardiovascular disease. In this study, researchers found that breaking up sessions of sedentary activity every 15 minutes with just a small amount of physical activity of any intensity can counteract much of the negative effects of prolonged inactivity. This is what some of the latest research and literature is supporting, that instead of trying to undo all your sitting, desk work, computer work, or repetitive tasks, even if it's more active and not so sedentary, but still repetitive and strenuous on your body, then it's good to not try and just undo it in the evening or 2 or 3 times a week, say with a class, yoga session. Those things are still very healthy for you, have tons of health benefits, and they will help in this regard. But the research and literature shows that negating those effects, especially with sedentary activity, are more effective in real time as you do it throughout the day. So good to have a strategy for that. Unfortunately, the Journal of the American Medical Association Psychiatry, April 2021, looked at suicide risk being elevated among nurses. Nurses, of course, right now in an environment that's very challenging, very stressful. I can only imagine how difficult it is to be working in, especially some of those areas that are very inundated with people who are unwell with COVID-19. So they are looking at an 18% increased risk in that occupation, and they're wondering how they can identify why it's elevated and what interventions can be helpful. So hopefully there's some improvement and some opportunity there to make things better for our frontline healthcare workers, especially right now working in such a challenging environment. The Journal of Applied Psychology, March 2021, talked about taking micro breaks to stay sharp at work. So those breaks throughout the day are good for our physical body, our overall health, but micro breaks being just short timeouts from work, functions that usually involve activities like getting a snack, chatting with coworkers, stretching, or doing a crossword puzzle can help workers maintain their energy levels and stay productive throughout the day. So that pattern interrupt, the ability to step away from what you're doing and come back to it, is not only good for your physical body to remind it that it can do more than what you've been using it for, but also to come back refreshed and ready to keep doing what you probably do so well, whatever you're engaged to do, as something either working for yourself or for somebody else or with other people. Then taking those micro breaks, even those natural breaks throughout the day for a snack, a bathroom break, whatever the case may be, very healthy for us and better energy and productivity. Finally, the journal Medicine, February 2021, talks about something called cervicogenic cephalic syndrome, combination of headaches and dizziness that could be brought about by dysfunction in the neck. And they talk about how manual therapy can be effective for cervicogenic cephalic syndrome. So if you know someone who suffers with headaches and it's accompanied especially with dizziness, that specific condition has been shown to be beneficial with some manual hands-on treatment. So encourage them perhaps to get assessed and see if it's a good fit for them. Of course, everything we talk about on the Daily Health Update could be further customized, individualized, and personalized. Some of that can be done with some research by the individual to make sure that it makes sense to them. But anything that's left unanswered, or if there's any uncertainty, or you just want to make sure that it's a good fit for you, you could seek out the advice and guidance of a qualified healthcare provider. Always a good thing to do. You live your life through your body, through your nervous system, and you want to make sure you're giving it an environment so that it's working at its best to have those great experiences you'd like to have each and every day. And that's why we're here with our Daily Health Update. Hopefully it helps with that journey. We'll be back this week a few more times with a video, and we hope you enjoy them. Share them with your friends and family. But even for yourself today, congrats for being here. A tap on the back. You'll have a great day, or you already probably had one, and knowing that you were going to get to your health at some point today. And we encourage you to keep doing that throughout the week. All right. So we'll see you tomorrow with your next Daily Health Update. Enjoy. Be well.